I'll never forget the moment I realized my balance wasn't what it once was. I was strolling through my kitchen on an ordinary day. No clutter, no distractions. Then out of nowhere, I stumbled. I caught myself, thankfully, but a shift happened inside me. A small voice whispered, "What if I hadn't caught myself? What if I'd fallen?" That moment lingered because losing balance isn't just about a trip or clumsiness. It's about confidence, independence, and above all, safety. If you're a woman over 60 or over 70 like me, here's something critical. Doctors say 99% of older women will face balance issues at some point. That statistic stunned me. 99 out of 100. But here's what gives me hope. Most of these issues aren't just aging. They're caused by things we can change, things we can fix. In this video, I'll guide you through 8 everyday mistakes that quietly erode your balance, confidence, and even freedom without you noticing. Some you might be making right now. Stick with me to the end, because mistake number 6, it sent me crashing to the floor and taught me a lesson I'll always carry. You're not alone, and you're not powerless. There are simple steps we can take today to feel stronger, steadier, and safer. Let's do this together. 1. Wearing the wrong shoes. When we think about balance, we often focus on exercises or medications, but one major culprit starts with our feet, our shoes. For years, I loved my ballet flats. They were cute, easy, and felt comfortable, or so I thought. Then one day, walking near my house, I caught the edge of a flat on uneven pavement and nearly face-planted into a rose bush. That wasn't just a close call, it was my wake-up call. As we age, our feet change. Arches flatten, fat pads thin, and leg muscles slow. Shoes that worked a decade ago can now put us at risk. A good shoe isn't just foot covering, it's your foundation. A weak foundation makes everything above it shaky. So what makes a shoe right now? It needs a firm, non-slip sole. No slick bottoms. It should offer structure, supporting your ankle and arch, not flopping around. Cushioning, like memory foam or a heel cup, is key, especially on hard surfaces like tile. And fit matters. Too loose or too tight can trip you up. You might think, I don't want clunky orthopedic shoes, but today's options are stylish and supportive. I found a chic gray pair with floral accents that look great and feel better. And slippers, I used to wear cozy ones all day at home, but their slick soles were a hazard. I nearly slipped carrying laundry. Now, even indoors, I wear shoes with grip. Not heavy, just stable. The difference? I walk taller, feel confident, and haven't tripped on that rug in months. Shoes seem small, but after 60, there's safety, confidence, and sometimes the difference between a normal day and an ER visit. 2. Skipping strength training. This one caught me off guard. I used to think strength training was for younger folks, gym sessions, heavy weights, loud classes. Not me. I figured walking, cleaning, and gardening kept me active enough. But it wasn't. After 50, we lose muscle every year, a lot. And it's so gradual you don't notice until you struggle to stand from a low chair without pushing up with both arms. That's not just aging, it's muscle loss, and it's reversible. I started small, no gym or fancy gear. I got light dumbbells and kept them by the couch, doing arm curls, wall push-ups, and seated leg lifts while watching TV. Some days I used just my body. The goal wasn't to look buff, but to rebuild lost strength. Within weeks, standing up was easier, groceries felt lighter, and I tackled hills with confidence. Most importantly, my body could react again. When you trip, strong legs and core stabilize you, preventing collapse. Strength isn't just physical, it's mental, emotional. It lets you tackle curbs, paths, or stairs without fear. Reclaiming freedom, just 10 to 15 minutes 3 times a week at home in pajamas makes a difference. It's not pressure, it's progress protecting you from falls and fear. 3. Ignoring vision changes. You might not link eyesight to balance, but they're deeply connected. I didn't realize this until I started tripping in dim light, blaming soft house lighting or clumsiness. One night, avoiding waking my husband, I tiptoed to the bathroom without a light and misjudged a rug's edge. I fell hard on my knee, limping for a week. Our eyes help our brains navigate space, judging distance, spotting contrast, handling steps or shadows. As we age, vision shifts, subtly affecting depth perception and balance. Many of us wear outdated glasses. I did for 4 years thinking they were fine. After that fall, I saw my eye doctor. My prescription had changed, and anti-glare coatings and low-light lenses made a huge difference. Lighting matters too. Dim halls or bathrooms can disorient. I added plug-in nightlights to my bedroom, hall, and bathroom. They're cheap but gave me confidence moving at night. Old scratched glasses or shadowy corners strain your eyes, leading to dizziness or vertigo. Clean your lenses, get an eye exam, and use brighter, warmer lights. Your balance starts with clear vision. 4. Overlooking medication side effects. This one hit close to home. A few years ago, I started a blood pressure medication, expecting to feel better. Instead, I felt off balance. Standing up, the room tilted slightly, just enough to pause and steady myself. I blamed fatigue or dehydration, but one evening, I stumbled into a coffee table after standing too fast. Reading the pill bottle, I saw it. May cause dizziness or loss of balance. I wish I'd noticed sooner. As we age, our bodies process medications differently. A dose fine at 50 might be too strong at 70, and multiple medications can interact. You must advocate for yourself. Doctors see many patients. Only you know your body. If you feel dizzy or off, note it. Don't dismiss it. List all medications, including over-the-counter ones, and talk to your doctor or pharmacist. When I did, my doctor adjusted my dose, and the dizziness vanished. My balance and confidence returned. Trust your instincts, read labels, ask questions. A small tweak can restore stability. 5. Grabbing furniture instead of using a cane. I used to insist I didn't need a cane. I was independent, just steadying myself on chairs or counters occasionally. But that's furniture walking, a common habit signaling trouble. I called it independence, but it was fear of what a cane meant. One day, carrying laundry with no free hands, I shifted on the hardwood and nearly fell into a side table. That scared me. I bought a lightweight floral cane with a comfy grip. It wasn't defeat, it was relief. I walked taller, moved confidently, and stopped grabbing furniture. People don't pity me. They admire the cane's style. A cane isn't giving in. It's choosing strength, safety, and peace. If you're reaching for furniture just in case, your body's asking for help. Listen to it. 6. Avoiding balance exercises. I didn't know balance exercises existed until a community center class. Expecting seated yoga, I was surprised to stand on one foot or walk heel to toe, and shocked at how unsteady I felt. I'd done nothing to maintain balance, assuming it stayed like breathing. But it doesn't. Aging stiffens ankles, weakens cores, and slows brain adjustments. The good news? Balance can be trained, even in your 70s or 80s. I started small, standing on one leg while brushing teeth, walking heel to toe across the hall, shifting weight with a chair for support. No fancy gear, just a few minutes daily. Soon I felt secure, stopped bracing myself, and even danced in the kitchen, something I hadn't done in years. Balance is emotional too. It's trusting your body. Free YouTube videos, senior classes, or insurance programs can help. Don't wait for a fall. 5 minutes a few times a week can transform your future. 7. Not drinking enough water. This surprised me most. Dehydration affects balance. Mild dehydration, sneaky and gradual, causes dizziness, confusion, and lightheadedness, raising fall risk. As we age, thirst signals weaken, so we might be low on fluids without feeling thirsty. I drank tea, coffee, and little water, thinking it was enough. Then came headaches, fatigue, and a dizzy moment grabbing the wall. My doctor asked about water intake, and I had no good answer. I started tracking 6 to 8 cups daily, not counting tea. The change was huge: more energy, better sleep, less joint pain, and steadier steps. Keep water visible, on your nightstand, chair, or in a pretty bottle with lemon. Herbal teas or broths work too, but watch salt or sugar. Hydration supports every system, including balance. 8. Living in a fall-unfriendly home. We overlook home hazards, rugs, cords, dim lights, because we know our spaces so well. But as our bodies change, what was safe becomes risky. Carrying laundry, I caught a rug's edge, twisted my ankle, and missed walks for 2 weeks. I reassessed my home. No bathroom grab bars, slippery bath mats, dim hallway lights, and low shelves forcing awkward bends. I made changes: non-slip mats, grab bars by the toilet and shower, brighter LEDs, motion sensor night lights, and waist-level storage. These weren't costly but gave peace of mind. Adapting your home isn't babying yourself. It's protecting independence. Checklist: remove sliding rugs, tape cords, add grab bars and night lights. Keep items at waist height. Use a shower chair. Ensure stair railings. Most falls happen at home, but most are preventable with preparation, not fear. These 8 mistakes, small things like shoes or water, bigger ones like vision or medications, add up, quietly stealing balance and confidence. But you don't have to accept this as aging. You have power and control. You're capable of strength, worthy of stability, deserving of a grounded life. If you've hesitated on uneven paths, skipped outings, or worried about falling alone, this is for you. You're not weak for being cautious. You're wise for preparing.